Hi, it's Mrs. Lewicki, and I'm going to talk to you about clinical decision making. This is my makeshift whiteboard for today's lecture. So, what is clinical decision making? What should that mean to you as a nursing student? It's used to prioritize decisions in healthcare. Whether we're making a life or death decision or a day-to-day decision, we use clinical decision making. Which patient do I take care of first? Which problem with that patient do I take care of first? And we use critical thinking as a key component in clinical decision making. So what is critical thinking? It's a deliberate intake of information. We're collecting data, we're interpreting data, we're analyzing data. From that data we draw conclusions. From that drawing of conclusion, we make presentation or presenting of that information, and then we evaluate and we look at that to see have the decisions we've made, has that improved whatever the problem was with the patient. Critical thinkers need to have intellect, creativity, inquiry skills, reasoning skills, reflection, and intuition. And we're just going to talk about a couple of these things through the rest of this presentation, but I am going to refer you to the voiceover PowerPoints for more information on those. So what is reasoning? One of those critical thinking skills is reasoning. So reasoning can be deductive, and that's called top-down. That means I have ideas and I use observations to make predictions. So I know if I get somebody after gallbladder surgery, I expect to see these kind of things. Inductive is bottom-up thinking. So that you're observing the patient, maybe they're grimacing, maybe they're guarding, whatever, and you come to the conclusion that they're having pain. But you use that to observe behavior, symptoms, and draw a conclusion from the cues. In clinical reason, we use clinical reasoning. We base that on previous situations that we've had, and we use that with what happened with that patient, what we've seen consistently, and that helps us predict outcomes based on that. Reflection is another critical thinking skill, and that we reflect on our patient experiences, and we're looking at what worked, what didn't work with that patient, what could we do differently with that patient. Were we happy with how things went? Were we unhappy with how things went? We're also looking at individual patients. Well, I tried repositioning them for their pain and that didn't help. So maybe I need to offer ice or heat or something that will help manage that pain. Ways that we use reflection in nursing education. One is through debriefing or even post-conferences. So in simulation, we use the term debriefing. In the clinical setting, we use post-conference. And we're encouraging you to reflect on your patient care, to reflect on that learning. Another way we reflect is through journaling. I didn't write that down, but that's another way that we reflect. So when we're looking at clinical decision making follows a step-by-step process. We're going to start by IDing the situation or the problem. We look at what the problem is. We're going to list alternatives and info about the current situation. We're going to compare, evaluate, what are the pros of doing something, what are the cons about doing something, what are the pros about not doing something, what are the cons about not doing something for each of the alternatives. We want to select the best option to try, and when we're looking in nursing and in healthcare, we want the least invasive. We're going to go with the least invasive management versus the most invasive. We want to put it into action, and then we're going to evaluate our success based on that. So one of the things that we use is the problem-solving method, and this you would have learned about in science in high school and middle school. We start with the nursing process, and we're going to talk about that more later in this unit, in this module. But we also use trial and error. Did it work? Did it not work? What went wrong? What went well? We also use our nursing intuition, and that takes time to build. And then we use the scientific method to help with the problem solving. When we put all of this together, we call it clinical judgment. Clinical judgment is a complex process of clinical decision making. It combines critical thinking with nursing experiences. And granted, you're brand new in your nursing experience, so you don't have that developed yet, but you will develop it. And it's from emergency situations like we talked about a few minutes ago to the day-to-day strategies. And it's a dynamic process. Patients' conditions change, so how I'm treating them has to change with that. And nursing judgment is an essential competency for nursing programs, and nursing graduates are expected to possess nursing judgment. All right, so one of the nursing theorists is Benner, and Benner developed a skill acquisition model. And what Benner recognized is that not every nurse at the bedside possessed the same amount of confidence and competence as they were providing care. And she discusses like whether you're a novice nurse, which you guys are already LPNs, so you're not going to be novice nurses. You've got some clinical experience. So you're probably in the advanced beginner, and some of you may have come to the competent level, but basically it goes from novice all the way to expert. And the expert nurse is the one that has years of experience and is competent and able to make those clinical judgments without relying on textbooks. Another model is Tanner's model of clinical judgment. And in Tanner's model of clinical judgment, that's the noticing model. So she says that nurses notice changes, and they notice when things, whether they're good changes or bad changes. And basically you use your intuition or your knowledge to interpret those changes, and then you respond by whatever interventions that you do, and then you reflect on whether or not that worked. Lastly, Lassiter's model, she built off of Tanner, and her model is we use primarily in simulation. It's the same thing. It's noticing, it's interpretation, it's responding and reflecting. And we look at that in clinical and especially in simulation because we make changes to the mannequin or the standardized patient for you to reflect. But in simulation, we make more overt changes than you might see in the patient. And that's it for clinical decision making.